Hello, and welcome to our ergonomic analysis of contract detail painting. Within this video, we have recorded the task of contract painters doing detailed paintwork within the ergonomic lab area located in the basement of Kettering University. As shown, this task consists of an operator using a ladder to reach any areas that are needing detail precision. The operator climbs up to this position with a paint bucket in his left hand and a paintbrush in his right. He then proceeds to dip the paintbrush into the paint, removing any excess before applying it to the wall. The duration and setup of this task varies depending on the dimension of the wall at hand and the amount of windows or objects protruding from the wall. The workstation space for the operator is his reach envelope of his right hand, or as far as his reach extends while the operator is on the ladder within 1 foot from the wall. While the operator completed this task, we noticed awkward postures of the torso when the operator extended to get to the furthest reach without repositioning his ladder. This also caused extreme radial flexion of the wrist, therefore increasing the amount of grip pressure he put on the paintbrush, and uncentering his balance on the ladder, which is a safety risk. The first assessment we conducted was the threshold limit value for hand activity, where we evaluated each hand separately, giving it a hand activity level, aka HAL rating, and normalized peak force, aka NPF rating. For the right hand, we gave it a HAL rating of 7 and an NPF rating of 2, thus putting it at a potential hazardous threshold limit value. For the left hand, we gave it a HAL rating of 2 and an NPF of 3, thus putting it at the recommended action limit for the task. The right hand potential hazard moved us to do the rapid upper limb assessment, or RULA, which gave us a final score of 7, thus showing the need for further investigation of the task to implement a change. To make sure we properly assess all postures of the worker, we did an assessment of repetitive tasks of the upper limbs, also known as the ART tool, in which we found the exposure score of the left hand to be 23 and the right to be 31. According to the ART tool, any exposure score that is 22 or more is a high exposure to risk, and further investigation is required urgently. Using the strain index assessment, we calculated the strain index on the left hand, which was about 5, indicating that there is some risk to the worker, and the strain index on the right hand, which was about 18, indicating that this job is highly hazardous to the worker. When conversing with the operators, they complained about pain in their knuckles and wrists from holding and doing continuous movements of the paintbrush for an 8-hour shift with 2 15-minute breaks, one in the morning, one in the afternoon, and a 30-minute lunch midday. Due to this, they have difficulties completing everyday tasks outside of work. We would like to conclude our assessment by suggesting corrective actions to be taken. This job has 3 workers, 2 doing the detail painting and 1 doing full wall roller painting. To minimize the worker's risk to cumulative trauma disorders, CTDs, in the wrists and fingers, we would like to have each worker rotate their task. And if applicable, we would like them to have ample amount of space so as to avoid the use of ladders, possibly using structures such as scaffolding. We would like to incorporate more ergonomical paintbrushes and accessories for use in the task. We thought the Galax G Ergomaster Pro grip accessory shown in the left picture would best straighten the worker's wrist posture and provide a more comfortable grip. We also thought that the ergonomic pain-free paintbrush shown in the right picture was the best choice in the safety aspect, since it can be attached to the paint bucket, allowing the worker a free hand while repositioning on the ladder. Thanks for watching!